Welcome, Dr. Hind. I am very excited to have you on my platform, and I'm so excited to share such interesting information and knowledge that actually we've been in deep discussion. So welcome, Dr. Hind.
Thank you, Fatma, and thank you for inviting me to your platform. And I look forward to our discussion today about mental health.
Thank you. Most welcome. Well, today we have very interesting questions for you. So we'll start off with our first question. As we know that COVID has affected our mental health, and we can see that there's a lot of statistical numbers that are showing the growth of many people seeking therapy, many people actually educating themselves on the importance of mental health. So if you can share with us some of the statistical numbers and some information of what is going on in our times post-COVID.
Yeah. Thank you, Fatma. I'm very glad that you brought this conversation and you started it with COVID and post-COVID, because honestly, the way it has impacted the whole world is worth mentioning and talking about. I'm going to run just through few facts, and few numbers just to realize what was going on and what is going on. So if we look at the mental health issues, and they are widespread in every community, every country, every continent, 1 in 4 people are affected by mental illness at some point in their lives. So all these information I talk about are available on the World Health Organization website. A huge portion of the population, as much as 70%, doesn't receive treatment for mental illness. And if you ask why, obstacles include lack of resources and trained health workers, and also many cases, in many cases, the social stigma, of course, is number one around mental health, and that is the greatest barrier for that. And lack of communication with many parts in remote areas as well, and also that people don't seek, mental health services sometimes, and they are silent about it. So that's something also, that is of a worry. And of course, with all the increasing numbers of suicidality, we are really concerned about this. People with serious mental illness are twice as likely to develop cardiovascular and metabolic diseases. Many of the diseases, come from stress. So that's something, that needs to be addressed. Depression is a leading cause of disability worldwide, affecting 280 million people from all walks of life. This is a number that if you go now, you will see it changed, because it keeps changing, as the time goes.
So do you feel that the numbers are increasing?
Because these are registered numbers. We don't know about the silent, that we don't, in silence, we don't know. These are numbers that came out of, visits, for example, to clinics, or people who had access to the services, or surveys or whatever, but we don't know about the people who were not visible.
Very true.
So, so we don't know. Yeah. And the number is changing due also to the stresses. Maybe it's increasing because, there are many events, there are many crises, there are many, disasters that are happening around the world that might also cause more and more, for example, natural crises and are everywhere. So these are, this is by default are causing many, issues and losses. And depression is, part of the losses that people go through in their lives.
Right. Very true.
Yeah. And then we have the pandemic that has taken a devastating toll on the world's health care workers with grief, anxiety, depression, post-traumatic stress disorder, and suicide, just a few of the potential long-lasting effects. You know, doctors are already twice as likely as the general population to die by suicide, and women are the most vulnerable ones. You know, I mean, I'm sure you heard of many of the doctors who committed suicide when they were exposed to such, you know, event where can we help, can we not help?
Yeah.
Which patient I will take the machine off, which patient I will give the machine, you know, prioritizing the needs. That is a need for everybody. So it's quite emotional, you know. So this was part of the, you know, huge issues that were happening. Yeah. And as children and adolescents, you know, face the pressures and the transitions of coming of age, and most cases go undetected. Young people living in areas affected by conflict, natural disasters, as we mentioned, and disease are especially vulnerable to mental illness and distress. So that's apart even from going into COVID or post-COVID. We're talking about a daily acts where all these youngsters are growing and, you know, developing physically, emotionally, mentally within an environment that, you know, has a lot of challenges.
Yes, that's very true. And I feel what we saw in the period of isolation, where certain children, their development communication skills were affected due to the isolation, which was the period where they should be interacting socially.
Yes, absolutely. And I would like to close this question saying that this answer, the global economy losses is about almost $1 trillion each year due to depression and anxiety. So that's just one number, you know. So these are little facts. I didn't want to go into too many details, just to show that, you know, why do we talk about mental health?
Yeah. No, these are very actually important numbers. And as you said, this is most probably only the ones that are recorded. There must be much more that's not recorded. So the awareness is important.
Yeah, that's why.
Yeah, great.
Absolutely. And that's why, you know, more and more information can be found, you know, accurate information, of course, can be found on the website of, you know, the World Health Organization and other organizations, you know, that are working within this field.
Great, thank you. Okay, so now we go into our next question. What is mental health and what are the types of mental health?
Right, yeah. So let's take a definition and say mental health refers to the overall well-being of a person's emotional, psychological, and social functioning. It involves the ability to cope with everyday stresses, you know, and challenges, maintain positive relationship, and engage in a healthy behavior. Mental health can be influenced by a range of factors, you know, such as genetics, environment, and life experiences. Mental health issues can include conditions such as anxiety, depression, bipolar disorder, and schizophrenia. It is important to prioritize and, you know, prioritize mental health and seek help if needed, just as one would, you know, seek help when they have physical issue. You see, that's a big challenge. Why it's so easy for people to go and seek help when they have a headache, when they have an injury or whatever, and it's not a stigma to talk about it and about the trauma or, you know, the accident they had. And it's such a challenge about mental health. So the stigma is very high here. Yeah.
That's very true. And I mentioned to you, like with my own experience, it's when I started feeling with my body the imbalance. And I wasn't aware of what was going on or how I could control what was going on with me. It did affect my mental health a lot. And actually, part of my cure was dealing with my mental health, which actually had balanced my condition. So it is very important actually to have that awareness.
Yeah. Yeah. And as we talk, I mean, if we talk about types of mental health, I mean, you have the mood disorders, for example, such as depression or bipolar disorder. You have the anxiety disorders. You have this personality disorder. You have psychotic disorders such as schizophrenia. You have eating disorders. You have trauma-related disorders such as PTSD, post-traumatic stress disorder. You have the substance abuse disorder. These are all, the types when we call them disorders. But remember, there are many, many. I mean, I know we will talk a bit later about anxiety specifically, but what I want to say, we all face challenges in our lives and we get stressed. We all, have an increase in our, stress hormones, followed by an increase in our adrenaline. So every day there is a challenge, so mental health is not only about a disorder or illness. It's about our state of mind that, help us to balance in life and keep going. So that is very important to address. So when something is impacting my life, and affecting it badly, don't I need help? So that's something, and there is help. So will I seek help or not? And what makes it so complicated that when it comes to this, that I'm not going to go and ask for help. While, if I see my finger bleeding, I will rush to the hospital to make sure that I stop the bleeding. Yeah. Because you see, these are all invisible things.
Yes.
When you talk about your stress, when you talk about your feelings, these are things that are not tangible.
Right.
And when we don't see it, we don't know even the size of it. We don't know how big is it until it starts really, really impacting our life so badly. And here, where, sometimes we seek help and sometimes, unfortunately, people prefer to continue in that alley where, sometimes they can take their lives away, unfortunately.
Yes, unfortunately. And it's very true. Also, as you said, sometimes it's a disorder, but as you said, problems are always there in our lives. So the problems are the triggers, and it's something that you cannot control. Problems will be there. So it's very important that we learn how to control it, even with people with disorders, which I'm sure you give therapy for. You give them sort of anchors or tools of when they feel triggered. So it's
and some people, for example, live chronically with it, and not only some people will want to take their life away, but it becomes so chronic, and then it impacts their lives so badly that they lose exploring their potentials, they lose living in a balanced way. Yeah.
Yeah, it's very true. I have a lot of clients that tell me I feel stuck. And yes. This is, I think, as you said, that they feel stuck. So that's why they don't have the awareness of, okay, I need to get out of this to move forward. So it's,
yeah. And it's okay to be stuck. It's okay to be stuck. And then, but after being stuck, what do we do?
What do we do? Exactly. So now we go into our next question. When do we need help? And why now we need to ask for help? Like we have been aware that they are therapists and psychologists and coaches, but why is it important now we are seeing that people are investing in going and getting help and are trying to understand themselves?
Yeah. number one, it's, because sometimes people think that, to ask for help, it's to ask for weakness, but to show that they are weak. And a lot of people don't like to show that they are weak. And also, we have to look at it also from the support system. If you look at it historically, how was the support system? For example, who was the support before? What are your resources for support? If you lived in a, let's say, collectivistic community, you have the whole family, for example, an extended family who you go to and seek help, and, and they are there on the daily basis, right? But then when you become like a nucleus family, both, a couple working, and then children are at school, and then they come home, and then, there are many challenges. We are all living with challenges in life. Then the stress comes, and then who is supporting everybody here? Everybody is interacting with everybody. So the family social part, when there is so many stresses, is impacted. So who's helping here? Who is providing the support? Families now became nucleus because, for example, communities has grown, and everybody, is living in different countries. So it's not that, it's a bad thing. We're progressing, but at the same time, how is the support system replaced? So if I don't have my mother around the corner, who would support me? Or how will I be supported? Right? So, and then here where it comes that, let's think about it as a support system. If I need help, it means I need to be supported to be able to come out of the stuckness.
Right.
And that is what is important. Yeah, well, sure. When you ask for help, one of the things I say to my clients, sure, you have consumed all the ways that you know. So it's not that you don't know. It's not that you didn't work. You really worked hard to resolve your issue. At the same time, you reached a point where you need help because, your resources needs to be refreshed. Your resources needs to be you need a new tool to cope with your life. So that's where we ask for help.
Yeah. And a point on that is true, like also the stage of when we ask for help. So like what I've noticed with myself, even with others, there are certain stages in our life that we accept to receive help or ask, or even have the courage to actually ask for help.
Yeah. And this is why when you ask for the help, and you put the word therapy, they are always, bringing the stigma.
Yes.
So that's where the issue is all the time. Yeah. So, psychotherapy or talk therapy always provides you with a safe, non-judgmental place. And that's the important thing, to vent about your experience, to explore your options and develop the skills, to handle various challenges in your life. So that's very important that, why do you go and see a therapist nowadays, or a psychotherapist, or a counselor, or, we will talk about all these definitions later on, because, you need that space. If you talk to your partner, there is the emotional part. If you talk to your friend, there is the emotional part. So when you go in a non-judgmental space where it feels safe and secure, it gives you the ability to look at your problem, to externalize it. And that's the important thing. When you externalize it, you look at it from all different directions. And then when you look at it from all different directions, you're regulating your emotions, you're really ventilating, you're looking into, what's now? Oh, I can see how stuck I am. And then, in most of the times, people find their solutions without even the therapist or the whatever you want to name it, gives a solution. Because that's a very important point to make, that, it's very important for the client to see that they are still empowered, they have the power, and we're like the backseat drivers, as they say. simply, I would say, it's very important that to look into their potentials and see it, and see that they are capable, they are in control, they're capable of finding solutions for their stresses and challenges. This is when we talk about, the challenges that within the range, because sometimes, we will need a bit more guidance when we talk about more, the disorders and the illness. So that's something else. Yeah.
Yes, and it's very true. I've noticed that's why also even in group therapy, they always tell you that you do not give advice to the other person, you share your experience. Because this way, as you said, sometimes people will feel judged, or sometimes the other person may have a different sort of environmental setting, and that is why they are reacting or practicing in a certain way. So it's important to know that each individual, whether it's our mind or even our environment, it's very unique in their own way. So there's not one solution for all.
Yeah, exactly. And here you brought a very important point, Fatma, that even in a group or individual, confidentiality is a very, very important point that we always insist and talk about it. I always say, like a broken record, I have to repeat it and repeat it and repeat it, because that's what gives the trust, and that what gives the space where the clients feel safe and secure to disclose and to talk. I would withdraw the word disclose. It's more, let's say, about how they are able to express themselves and see them, and really regulate themselves by themselves in a space where it's holding them non-judgmentally, congruently, to be able to, find their way in life and find the way they balance their life. Yeah, so confidentiality is a huge issue that we emphasize on, and professionally, it is one of the important pillars in the therapy.
Yes, and I've noticed also this: the being judged is one of the fears. So with a therapist, you know that you are safe. You're not going to be judged. You will have someone who will clearly listen to what you have to say.
Absolutely. Yeah.
Now, actually, we are going deeper into learning about what different types of therapists are they and at what stage we go. So the question would be here is, what are the type of therapy and at what stage do we use each services?
Yeah. Quite often, people will ask you what is the difference between a counselor and a psychologist and a clinical. So I think it will be good that if we run through a bit of those definitions, and then we talk about the types of therapy, because it's very important when clients walk in. Some people call them clients, some people call them patients, So it's very important here to know what are the definitions, for the audience to know, the definitions, very simple definitions now about some of the professionals, because there are many. I don't want to take the whole time just talking about definitions. For example, when we say psychiatrist, for example, we define the psychiatrist as a medical doctor, MD, or they call DO, who specializes in the mental health, including substance use disorder. Psychiatrists are qualified also to assess both the mental and the physical aspect of the psychological problem. So people seek the psychiatric help for many reasons, but mainly, we talk about the how the psychiatrists are the only professionals that can prescribe, for example, when necessary, the medication for the patients.
Right.
And then you have the clinical psychologist. So the clinical psychologist, it's the psychology, it is the study of how people think and behave. So the clinical psychologist undergoes an extensive training in different types of treatment modalities in order to assess and treat both adults and children with emotional and behavioral difficulties. And then you have the psychologist. A psychologist is a professional, who practices psychology and studies mental states, perceptual, cognitive, emotional, and social processes and behaviors. So their work often involves the experimentation, observation, and interpretation of how the individual relate to each other and to their environment. And when they have challenges, how, their behavior is impacted, how they are emotionally, for example, as we say, stuck, how do they change their behavior for, a better life, for example, and what are the reasons? Is it, negative thoughts? Is it highly charged emotions? Where is the issue here? What is the presenting issue? And what is triggering, for example, something that needs to be addressed? Right. So that's the psychologist. You have also the counselor, which is an individual professionally trained in counseling, psychology, social work, or nursing, who specialize in one or more counseling areas, such as, for example, vocational, rehabilitation, educational, substance abuse, marriage, relationships, or, family counseling. So the counselor provides professional evaluation, information and suggestions designed to enhance the client's ability to solve the problem and to make decisions and, to reach an effective change in their lives where, and then eventually, of course, there will be a change in the attitude and behavior. So these are a few definitions because these are the major, professions that, people ask about them. So I hope that the very simple differences between all these. Yeah. And then if you want me, I'll talk to you about the different types of therapy, maybe. Yeah.
Before we talk about the different types of therapy, the reason why I wanted you to explain each therapist and what it is for, at what stage, because with each definition that you explained, I find interesting, like usually people say if I'm depressed or I feel I have a compulsive disorder or something, straight away they'll tell you, go to a psychologist. But from what you have explained to us, maybe that is not the therapist they need to go to. So this is very important, and I'm very happy that you shared this, that each individual can define then which stage they are and which therapist they need to go to and what type of therapy to actually get. So great, now we can actually go deeper into that, and if you can share with us the types of therapy.
Yeah, a very interesting, Fatma, you say this, because, there are many types of therapy here. And very important, we look into different ones because, people now go on the internet and they start diagnosing themselves. Yes. And here where, sometimes I call it the crisis that happens that, now I have this, and then I will, say that, oh my God, I've got OCD. Oh my God, I am severely depressed. Oh, am I bipolar? So, and of course, they might see some similarities in few behaviors, but unfortunately, that's not all of it, and that's why we say, don't diagnose yourself over the internet and go to the expertise who will help you.
Yes. So now we will ask in more detail and learn more about what are the different types of therapy within the field of psychology.
Okay, so there are many. As you know, things have evolved. I mean, if we look at the past, and how the field of mental health developed, that started, of course, from the initiation, of mental health from psychosis, and then we went to the fields, starting from Freud, and then all the divisions came into the humanistic, existential. So there are many, many types of therapy nowadays. The most famous one, and a lot of recognize it, is what we call CBT, cognitive behavioral therapy. So that's one type of therapy that addresses the negative thoughts, and there is other ones like the mindfulness-based therapy. So it depends on the mindfulness part. And then you have the family therapy, the couple therapy, you have dialectical therapy, you have acceptance and commitment therapy. So as you see, art therapy, for example, we are evolving so much in this, and every time you will see that, a lot of therapies are coming along, and you will find many are evolving from people's experience, because, I think we became more open and more experimental in this, that, the field is really growing. Although there is a part that says mental health has a stigma, but at the same time, there are many, many resources. I always call them resources, and we are evolving and combining. I mean, if you look at art therapy, and I'm sure you experience the colors and you work with colors and you see how it's impact on people. So I'm sure you experience this on daily basis in your work. So yes, so many, now we are into the music therapy, dance therapy, sound therapy. So it's evolving slowly, it's coming more and more. Yeah.
Yes, very true. And I feel like the mindfulness therapy now is very popular. As you said, I've seen it with my field of work with the color therapy, for sure, that it has helped not only individuals understand the tools to use with the color so they can change their emotions, but they've also learned about their strengths and weaknesses within the color groups that we deal with. And sound therapy now is extremely popular. So what is nice about it, as we know in our field, it's all about your senses. So it's stimulating the senses, trying to create balance with your senses. And an interesting fact, people, Dr. Hind is the first person who introduced me to the world of color psychology. So you have to thank her for actually getting me in the field of psychology.
Thank you, Fatma. It's a pleasure. I wanted to say here, sometimes, for example, we get a client saying, I'm sure you heard also about the EMDR, therapy, for example. Mm. So sometimes people come to the clinic and say, okay, I want to try CBT, or I want to try EMDR, or I want to try art therapy. Now, this is very important that, okay, what did the client grasp from the information they got over the internet or a book they read or whatever? Because they might think, oh, I feel good when I read about this, but would it be the suitable one for the therapy? I don't know. So this is why, it's very important here how we clarify these things to the clients. And it's very important that what suits you, it's more like, it's not that, okay, I have all these tools, but I'm not going to go and use it unless it will help the client to, evolve and progress and have a growth in their life. And, deal with the stressors or challenges that they came looking for a solution for it. That's very important. And this is why the variety is very beautiful, because even if it's not me, I can refer to, somebody else who I would find more qualified to do other type of therapy for them. So the variety is very good. At the same time, it's very important that, and I always insist on this, that, we meet the clients where they are. Not that because I am trained in something, it will suit everybody.
Right.
that's a very important point I wanted, to highlight on. Yeah.
Yes, I completely agree with you, because even when I have clients, they come and tell me, as you said, like they define what they have, So a lot of people come and tell me, I have depression and I need to know what colors to deal with that. And this is where I always tell the clients, when you come to your session, think of yourself as a blank canvas. Don't come with different judgments and ideas. Be a blank canvas and go through the journey with the therapist. And this is when things unravel.
Yeah, and there is a very important point here as well, because, when do we as therapists realize our limitation? Because it's very important that when do we refer? When is it, when are we not suitable to do therapy? Are the clients comfortable or not? Are we the right fit? There are many, many, many aspects here, that the most important thing is that, to meet the needs of the client more than anything else. Yeah.
That's very true. And you and I practice the same thing. As you said, when we see which stage the client is, and if we feel someone, it's another stage of a person that needs certain expertise that maybe we may not be qualified to, we refer them to that. And that's important, because we do have this problem with some therapists who try to do everything, but it's not possible, because each one also, I feel, as a therapist, as a personality, you have a certain sort of intuitive talent of being stronger in certain things. So it's important also as a therapist to be aware what are your strengths and what is something where you need to refer your client to somebody who has what they need at that time.
Absolutely. And I think this is where the relationship between the client and the therapist is very important.
Yes.
The transparency, and it is, if building the trust is very important, and the transparency is very important, that when we read each element and I say, look, I might not be the right fit for you in therapy, and maybe we need to refer or something. Sometimes clients say, no, but what did I do wrong? I feel more comfortable with you. But it's not about comforting me. It's more about, yes, but, what about you? We are getting stuck somewhere. Always, we have to know our limitation and the benefit, what is the benefit of the client. And that's, very important, because it's not about just having the knowledge and insisting that I can treat this client. No, it's really about what is good for the client. What do they need now? What do they need today? Is it, something I can help with, or is it really I need to repair? Yeah.
It's very true. It's the connection that you have with your therapist. If you connect, you relate, it will work. If you can't relate, or maybe you are not at the stage to deal with what that therapist has to offer, then this is where I feel you get the conflict going on. Yes.
Yeah, and I always encourage my clients, and I say, it's okay if you have something to say that you didn't like the therapy, or today I said a word that did not represent how are you feeling, for example, or you thought that I was too harsh, or so I always encourage them to express their experience. Yes. With the therapist, because also that helps them to see that this is really a space where they can be very transparent and able to express whatever they experience in that moment, and that in a way it helps the client to see that they are capable through this relationship, because most of the time when we talk about our stuckness or something, it can be in a relationship, it can be in a way dealing with certain persons, in a way dealing with our children. So it's very important here that we are exercising this in the now. If you can tell me that, you know, when I said that word, it was painful for you, then we take it from there. And, you know, as we say, tear and repair, it's very important that, okay, what needs to be repaired here? You know, what happened here? And, you know, what is it you didn't like about the word? And what triggered you when I said that word? So it's always, you know, in the now where the client experiencing something, and then that might lead, you know, it's an experiential moment where the client will, you know, evolve and grow, and then, you know, see their potentials and find the solution by themselves sometimes. Yeah.
Very true. Yeah. So the key thing I would say is like the sense of openness and trust. This is, I feel, the core of it. Yeah. Now that we have spoken about how do we define mental health, stages of mental health, what therapy we receive, we want to talk about the future of mental health. So how do you see the future of mental health psychology evolving, particularly in terms of accessibility, affordability?
Yeah. Very important question and very difficult question to answer because it concerns the future.
Yes.
Yeah. But let's say maybe the big curve of learning was during COVID. You know, we go back again and again and we talk about COVID because really I know the pain and the wound that COVID caused to us and the losses we had from COVID. And at the same time, it really pushed us out of our comfort zones and out of the box, and to think out of the box and to be creative, innovative, to find many, many ways to help, you know, and make people really feel they are not isolated and we are there for them. So, you know, a big revolution, if you think about it, how the, you know, the artificial intelligence worked here, how digital world, how the virtual platforms were really so active in terms of education, in terms of therapy, and in every single thing in our life. Yes, it has its advantage and disadvantage, but let's talk about how many, I mean, I'll give you just a fact, and if you allow me to read it, that, you know, as per a study in the States by American Psychology Association, surveyed clinicians, and they showed that 2%, you know, they were serving virtually 2% of their patients. Mm. And when COVID happened, it jumped into 82%. So you can imagine that, you know, that all these physicians were conducting their sessions, you know, and their services virtually. Mm. You know, medication prescription, you know, sitting with the patient, looking into the symptoms. So in a way, you know, okay, still, I don't know, like, you know, studies are still ongoing, but this shows you that it took out all our potentials and what are we capable of. Yeah. So that's very important. It opened up so much to talk about mental health. And yes, I am stuck, I am anxious, I am angry, you know, the lockdown was very, very difficult for a lot of people. The lockdown was very positive for some people, but you know, people started talking about their stress, about how they feel. People started supporting each other. People started communicating with each other. So it moved a lot of things. And I think, you know, part of it is the AI, you know, part of it is the virtual part. But the other part is how much mental health is becoming more and more, you know, upfront in the strategies of the countries. And how much, you know, we're looking now, don't forget, we're looking now into the well-being of the workers, well-being of the employees, and, looking into the happiness. These are all indicators. If I want my employees to be happy, then, that is a big part of it, that, I look at their well-being and, what makes them happy, what brings them to work, what motivates them. So if I can do that, I'm moving something in them, and that makes the sense of belonging, that makes the self-worth, that makes, the self-confidence so high. So people are more, into their work with quite big motivation. So yes, I think we will progress more and more. And also, the people became more curious. Yes, I mean, with cautious, I would say we look into the internet and think, what is there for me to help me? Yes, some people will go for the diagnostic part, but now you have a lot of applications, that are helpful. I can't sleep, and then there are many, many applications. How do you use them to help you to sleep? I need some relaxation exercise. How do I do my meditation? So it's, in a way, it's quite helpful. Some people prefer it, because also people will tell you, I am busy, I cannot commute every day. So it brought a lot of aspects where people can use many, many things in their life. Now you see most of the people are wearing their Fitbit or their, whatever you want to call it, their gadget to look into their heartbeats. Yes. Some people, I monitored myself when I was talking to my employees, and I saw how my heart rate was going up. I realized that, I have a problem here when I stand and talk, that I feel there is something there, that my anxiety goes high. And I monitored it through my heartbeats, for example. People look into their temperatures, because some of the apps have this temperature thing. People monitor their sleep. So they're very engaged in their well-being. Because, it's very, very easy these days that we live in our head. And then, as I say, we need to bring the mind home where it belongs, to the heart, and to the body. So being engaged with all these is very important, because it brings you back, to be grounded and to live the moment, because that's what you want, to be present and to live day by day, and not just to be just caught, with this dilemma of, this is the problem, how I resolve it, and this is going to happen. So it's all with elevated anxiety instead of just, living your life and living your moment and being present to know how to act and not react.
Right. Yes, very true. And I feel even in other fields of medicine, in terms of treatment, also technology has really made it easy to sort of live with a certain disease because of the technology that you have around. So you have a sense of normalcy to your life. And as you said, like your Fitbit or your apps for Calm, there's also an app that you can put your finger on the camera, and it calculates your stress level. So so it's all this technology definitely makes it much easier to be aware of your triggers. Also have tools, for example, when, as you said, people who don't have time are on the go, have simple tools within their phone that they can practice for like 20 minutes a day, to just take that time out, as you said, to be present, to connect with your heart. It's very important. I've also noticed in terms of like the emotional intelligence is also increased, where people are more, I feel, empathetic to the fact that you're stressed. And sometimes they even help you with the stress. So this is also a sector of, I would say, mental health that has been also addressed, which is the emotional intelligence part.
Yes. I mean, it's very important here that, there are many parts. You have you have, as they call it, the emotions and the body and the mind. So you have the thoughts, you have the emotions, and you have the body. People will categorize it differently, you know. But if you look at it as a triangle, you know, you need every corner of it. Yes. So, you know, you will see the books now from the cognitive intelligence into the emotional intelligence, and the new is the physical intelligence. So the word intelligence is sectoring into everything. Yeah. And I just wanted to say, Fatma, here that it's very important we remember something. The human, nothing replaces the human touch. You know, the sense of belonging is very important. As humans, we, you know, still we yearn, we look into that human touch, which I think it will never be replaced because it's very unique and special for the humans, you know, and that's what makes the sense of belonging. At the same time, you know, on one hand, yes, I mean, technology can help us to connect. Technology can, you know, have very, very positive sides of it, but it will never replace the human touch. At the same time, you know, how much I can, when it comes to the need of accessing services, it's a completely different thing, you know. So we will do anything that to help people to access, you know, mental health services to meet their needs. So when it's a need, it's different, you know. We will tend to explore always many ways, and you know. Here where, you know, what is limiting us makes us more creative, you know, that, no, how can I reach? How can I, you know, people are very far, how can I reach them? People are in need of a different way of therapy, you know. And of course, on the other hand, I'm sure, Yani, the efforts are always there into putting the mental health on the top of the agenda, you know, of many strategies in many countries that, you know, this is something that needs to be addressed and you know, spoken about openly more than before.
Well, now we want to talk about the most important thing that everybody is constantly complaining about, which is anxiety. So can you define to us exactly the definition of anxiety and why has it increased in our present time?
So anxiety, who's not anxious in this life, you know? So anxiety is a feeling when you feel not at ease, you know, and, you know, you start worrying. And anxiety, you know, can come mild or severe. We all experience these moments of anxiety. You know, for example, you might feel worried and anxious, you know, about sitting an exam. We know all the students, you know, will have this anxiety. Oh my God, am I going to fail or not? Will I make it or not? You know, and it's quite you know, common amongst students, for example. But anxiety, you know, who doesn't get anxious? Who doesn't get worried? We all. There will never be somebody who will tell you, I have zero anxiety, zero worry, you know. So that's the most important thing. To what level we call it the normal anxiety, because you could be anxious in a positive way. Oh my God, tomorrow I have an exam. And you know what? If I don't study, then, you know, I don't know if I'm going to pass or not. Okay, let me study. So it motivates you to study because, you know, then you know if you did your homework and you studied, then, you know, you will pass your exam. Mm-hmm. But then if I sit here and I say, oh my God, tomorrow I have an exam, and then I start biting my nails and then, you know, procrastinating, and then I'm very anxious. I go to the exam and then I see my paper is blank and then I don't know what to do. And then I start developing higher symptoms of heartbeats, you know, sweating, temperature, shivering, shaking my legs. Then we say, okay, that is where it's gone far, you know, further than an anxiety that I can control. So it's out of control. So here where, it becomes leading my life instead of me managing it and controlling it. So it becomes under control. And here where we say also, if it's repetitive, as it's a repetitive pattern, every exam is happening, I'm getting that, all these symptoms, is it developing into more of a panic attack? What is happening here to me when I get anxious? Is it controlling my life? How much is it impacting my life? Am I withdrawing? Am I getting, very anxious that people are noticing it and telling me what is wrong with you? You've changed, you're not the same like before. So here where the level we say, okay, here where it's an alarm saying, okay, maybe I need help. So, for example, I always ask my clients on a scale 0 to 10, how much, for example, do you see your anxiety, for example, in this situation or that situation? And then we start explaining why do we call it, for example, above 5, and, and what do we do here about it? So that's very important that, we look into the symptoms and how they exceed. Then I would call it, okay, your anxiety really needs to be addressed. But for example, I'm anxious about my exam, and then I went to the exam and I did it, and then I feel a bit better. The exam was easy or whatever. And even if it wasn't easy, and I said to myself, okay, never mind, I will do okay next time, then I am okay. But when it starts impacting me severely in a way, and developing those symptoms and more than those symptoms, then, that's where we need to address it.
Right. And very interesting, you were saying, when you see that there's a pattern every time, that this is how you're reacting. I had this in college. I used to be great in essay exams, but I had anxiety when it came to multiple choice. And I was used to get shocked, like, I know the information, why I cannot process it? And every time I had this anxiety. And what was good is, like, at the time I was studying sociology and I was studying psychology, so I was a bit aware. And I went to actually the tutoring center, and I told them I need to do an assessment to see if I have a problem in processing information. And it turned out to be something very simple, that I'm the type of person, for example, when I read a chapter, I have to write it down in my own thoughts for the information to stay, and process it. And when I started practicing just a very simple, change in the system of how I was studying for the exam, the anxiety just went away. So it's very interesting that, and as you said, it's a normal anxiety. Any student in university has the anxiety of an exam. It's part of life. So, but yes, I do agree with you. I've also had stages where the anxiety has hindered my life, where I'm not able to work, not able to be around people. So definitely being aware of when it is level 5, as you said, is when you go seek help. Yes.
Yeah. And don't forget, anxiety is always when it really hinders your functioning. And there are many reasons for it. I mean, even genetically, research has shown that there may be a familial disposition, to anxiety disorder. Environment, all the traumatic experiences we are exposed to, stress, abuse, many factors in the environment can impact us and cause. It starts with anxiety and then it develops into, more serious disorders, or the symptoms really evolve very strongly, specifically if we talk about traumatic events, for example. Anxiety also have its psychological impacts, and also it can be related sometimes to underlying other mental health issues. So it can be OCD, obsessive compulsive disorder. And as we said, it could be post-traumatic stress disorder, so it doesn't come sometimes, on its own. Sometimes, physically, people might have, for example, let's say, I have, for example, children who are discovered to have diabetes type 1, for example. And then you can imagine how hard it is for children to cope with balancing the sugar.
Yes.
And then they become so anxious about it, and how to sort of help the parents to maintain, to maintain the level of sugar and to maintain the level of anxiety.
Yes.
So sometimes even, chronic illnesses, sometimes physical illnesses will cause anxiety, and it might lead into depression, for example, or the person being obsessed about their diseases. Mm-hmm. So, the physical part impacts and leads to also, stress and anxiety and depression, after car accidents, after injuries, after, any accident. There is a part of it, of the well-being, which, is impacted, which is, our mental health status, our emotions. Mm-hmm. How are we regulating? We're traumatized with the news about illness or something. So, so that's very important also, that anxiety can be, a cause of, it could be the presenting issue, but then it's rooted to other things. And that's why when we see how much it's impacting our life, we need to, explore and look into it more seriously and see what are the causes here. Yeah.
Very true. And it's interesting you touched on the type 1 diabetes. It's very true with especially children. As you said, how are they to control it? And I'm a type 1 diabetic, and part of it also, due to the imbalance, you get anxiety. So sometimes you have no control of it because your body chemically is imbalanced. So it's causing this. Sometimes it's not an outside factor. And I remember at the beginning, for me, it was random. Like, I'd be driving and there's nothing wrong, and suddenly I would get anxiety. And also in younger patients that I have seen in our support group, they have the anxiety of, for example, physically not being able to do certain activities like the rest of the kids, because it stresses them or will cause their blood sugar to. So they also feel like sort of isolated. And that is also another common thing that people with diabetes suffer, is like, aside from anxiety, is the isolation. Because you're always cautious, like, can I do this? Will this affect my sugar? So forth.
And why me?
Yeah, and then sometimes even like, your body, but then sometimes people are afraid for you not to get sick. Yeah. So they are also super careful around you, and that also makes you feel uncomfortable. So as you said, there's so many variations of anxiety,
Yeah. It's very, when you look at it, it's very complicated. And here where, it's complex, let's say, where, how do we manage all this? Yeah. It's quite stressful, it sort of makes the whole environment stressful. So how do you deal with that? How do you manage all this anxiety? If the mother is anxious, the father is anxious, the child is anxious, each of them will need, some kind of support.
Right.
So that's why, we talk about how much, seeking help from professionals in that context. Yeah.
Now that we know about when for us to be aware and the type of anxiety, can you tell us a little bit of how do we deal with anxiety? What are the practices that we can?
Yeah, I think, if we talk about, like, let's say our daily life, and how do we deal with our daily anxiety? Let's call it the anxiety within the manageable, field, let's say. Of course, when I say you bring the mind back and I say you live in your head or we live in our head, it means how much are we, for example, relaxing, how much we stop thinking, and how much we are mindful that let's pay attention to our body. Do I need some relaxation? Do I need, sometimes I'm so stressed, I need to release, for example, my anger or something. Let me go to the gym, let me jump, let me do something, let me exercise. Quite often people say, do your breathing, just sit for a few minutes and just breathe in and breathe out, and that will help. Some people are anxious that, oh, I don't have time to do this and this. Okay, how much I'm going to be mindful about looking after my food? How do I eat my food, and what are the type of food that, increases my sugar level suddenly, and then it drops down suddenly, grabbing the chocolate, eating. I'm not saying don't eat chocolate, but I'm saying that how do I organize my food, that in a way that it doesn't stress me, there are many, how do you build up your self-esteem? How do you look into, many things that are accessible. I'm not saying go out of your way to find something. What is there in your life that you can change that will help you? So when we say a change in the lifestyle, it doesn't mean, okay, shut this life and go to another life. On the contrary, what is there in my life? What are the resources I have that I can use, to relax me? If I am in the office most of the time, can I stretch for 5 minutes? Can I walk around? For example, will my Fitbit or whatever remind me, to do 1, 2, 3? So it's very important here that I have my resources there and I have my reminders for my resources, because it's very easy we get carried away. We live in our head too much. So we need reminders for that. How much can I go in nature, for example, not necessarily every day, but at the same time, when I have an opportunity, how am I organized with my vacation? Some people say, I don't need a vacation, I'll take 1 day or something. How much I commit, as I commit to my work, how much do I commit my responsibility towards myself? So that's very important, because if I commit to relax myself, I'm being more productive than just, to keep going, and suddenly collapsing. So that's very important. Now, let's say dealing with anxiety, also when we talk about it, in general, we talk about, for example, our food, how we balance our food, how we avoid substance use, how we take time for ourselves, time off, as we say, for ourselves. We switch off of our gadgets, we switch off, because there is a big pressure, even if I'm not working, the pressure is I have to catch up on the social media, I have to see what's happening in the world, I have to communicate with my friends, I have to keep up with what is going on. So that is very stressful. We can do all this, but with limitation. I don't have to sit for hours, for example, to see what happened in the world. But, I can, the thing is, when we talk about mindfulness, is to be and not to do.
Yes, very true.
How much challenging is this? And as humans, how much we can do that, and our brain is 24/7 working.
Exactly.
It's quite a challenge, and the pressures, and every day there is something new, we're like in a like a tornado, I say, and we're trying to get grounded. So it's very important to create our own resources for that. It's, sometimes people, when they are stressed, they can just keep a journal, for example, and just write down. Because when you write down, you are just sort of transferring, externalizing what is stressing you. So it goes, in something in front of you instead of it being in your system. Breathing in and breathing out. I mean, very, very simple. But really, I think we don't have resources. I think how much do we commit? And how do we contract with ourselves to care for ourselves? Right. That is very, very important, you know. And of course, if we say, you know, on the daily basis, if I do little things on daily basis, I'm building up a preventive, a plan, a prevention plan for myself that I am preventing to increase the level of anxiety. I'm reducing it all the time. You know, when I insist on sleeping really good long hours, you know, that are enough for my body, that in itself, you know, allows the body to, again, rebalance itself. You know, that allows the body to reduce the level of stress. When I insist and commit that I will eat, you know, in the right time, or I will take my break and I will, you know, I'm not saying stop working, don't stop working at all. Nobody will stop working. But at the same time, as I commit to that, how much I'm committing to myself as well. So it just, you know, the resources are a lot, but the commitment is more important. And when I commit, I'm preventing. You know, I always tell my clients, the football players, for example, they train and train and train and train and train for a match of 90 minutes. But if you sit and watch the 90 minutes, just see the way they run, and with a break of 15 minutes, they're running all the time. So imagine how much strength they have there, because they trained and trained and trained. And the more you train, the more, you know, the more you commit to look after yourself, you know, the more resources you will find, and the more grounded you are, and then, you know, the more present you are in the moment. So when we say the more present you are in the moment, means, you know, when a threat comes or something unknown happens, or I'm not expecting something to happen, you know, how much at that moment I am ready to respond, I am ready to act and not react.
Right.
You know, and that's all of it, because then I am managing that. I'll be stressed, but I will be able to come out of the stress easier than when I am, you know, my level of stress is so high, and then I am, you know, in a pattern of stress that always drags me down, and it doesn't help me to stay in a state where I can manage my stress. Because, you know, we will always, you know, face the unknown. But how do we strengthen ourselves to face that unknown?
Right.
That's what matters. You know, nothing will stop in this world from coming to us. You know, every day I don't know what is waiting for me. You know, you might be driving on the road and then you see an accident in front of you. You know, your car is not working in the morning. That is stress. So how much I will be able to take that and say, it's okay, you know I'm going to be late. What am I going to do? So it helps you to manage what to do when the unexpected thing is happening. So that's very important.
That is so true. And as you said, during COVID, it sort of taught us to pay attention to this, because we looked within the resources that we had around us, because we couldn't go anywhere or, you know, go to a therapist. So we converted to online, or you saw resources within your house, or you made sure you had practices that you were trying to keep calm during a very anxious time. And for me personally, like COVID taught me that before COVID, I was literally on a plane. I was barely in the country. I was feeling guilty all the time that I couldn't spend time with the family. And but I was enjoying and loving my work, every moment of it. So there was that internal struggle. And then with COVID, I was forced to stop and look at my life. And at the same time, as a business owner, all of us were on such high level, but I straight away, like, as you know, my personality always save the world. So I went into what can I do to help everyone, you know, and this is where I started the online courses and you know, talking about how to use color to keep our anxiety. But what was nice about it, it did bring order to my life. And this is where I focused on mind, body, and soul. And I worked on that. And for sure, journaling was one of the best things that I did. And it keeps me very grounded. And I actually see the phases of what I am growing out of. So interestingly, like how I break down my journal is first I put the progress. So what am I progressing in practicing? Then I put what have I learned for the day? And then for my experience or even sometimes something I read that I find interesting. And then I put gratitude, which has been very helpful because, as you said, because we're always on the run, you kind of forget what you need to be grateful and the good things around you. So the gratitude section always helps actually ground me. And my final part is always letting go of what worries me. And interestingly, Touchwood, I would say it's been 6 months. That last section, I have had nothing to write. So it's showing me that, you know, how much I'm progressing, how much I have control. As you said, things are happening, but then I have control over, okay, this is, I have a surprise, I can handle it, it's fine, you know, and this is next and next and next. So definitely all these practices and being mindful is an excellent way of dealing with anxiety. So
absolutely. And one thing maybe, we could say is like, it's okay to be anxious.
Yes.
You know, we all go through it and it's okay. And when we say that, I don't know, I mean, many of my clients, when I say to them, you know, it's okay to be anxious. How does it feel when you say it's okay to be anxious? Mm-hmm. You know, some of them say, I feel it's coming out of my system. So it's, you know, and some people say, I don't feel alone. Mm-hmm. So, you know, it's okay to be anxious. And then, you know, when we say this, it's more of a confirmation and affirmation that we are in control of it. It's not controlling us.
Yes.
And that's the main thing, because, you know, when the unknown happens, you know, unexpected things, a threat comes to you. Yani the most important thing here is that the unknown always is surprising. It takes you by surprise. And then, you know, immediately we fear. Fear comes in. Oh my God, what am I going to do? And then when I say, what am I going to do? That is the fearful part where, because I don't have access to information. I have no information how to deal with this unknown that came to my face. Right. And then when you think about it, you know, here where we fall in the trap and here where we are anxious. And it's okay because, yes, I don't know. We didn't know when COVID started what is going to happen. Yes. Now, when you say the word COVID, I guess if you measure the level of anxiety of people even will smile now. Yeah. But at the beginning, you know, it was so stressful. Yeah. And I think we got many lessons from COVID, you know.
Yes, for sure. But and I agree with you, honestly. Like, as you said, it's a normal emotion. We have sadness, we have happiness, anxiety, even fear. These are all normal emotions of what makes us human. So we need to understand that it's not a stigma or something that's wrong with you. It's just an emotion you hold, and you have different levels of it. That's all. Yeah.
And we go through, you know, pain.
Yes.
I mean, sorry, but it's pain. We have to go through it, you know. We cannot avoid it. Yes. But then, you know, how do we deal with that pain, you know? But when we say, it's okay, I am in pain, you know, I'm addressing it. I'm recognizing it. I'm saying, yes, I have pain. Then I know how to deal with it. Yeah.
Yes.
And I always say, you know, when you have your worries, if you look at the sky and see the clouds go in one, unless there is a storm or something, but the clouds always pass, you know. And I say, don't avoid your, you know, negative thoughts or something. Just imagine it passing by. Yeah. You know, when really you can't do anything about it and you look at it and you pass it, you know, it's just going, it's going. So you already thought about it. So let it go.
Yes.
You know, when you say let it go. Yeah.
Yeah, as the saying says, this too shall pass. So it's definitely part of life. Yeah, for sure. It's a process we go through as humans. So, and we're very resilient, as we have proven ourselves. So
yes, as human beings, of course. Yeah, and thank you for bringing the word. Yes, we in our human history, how much resilience we developed inside us. You know, through the history. You know how we survived.
Yeah,
it shows you, you know, how resilient we are. Yep.
Well, great. Thank you so much, Dr. Hind. This has been a great conversation.
Thank you.
And I'm sure the audience are going to love all the information we have shared with them. And I will be posting Dr. Hind's information if you'd like to contact her. And I will be sharing all the information that we discussed also on our YouTube channel and on our social media. So thank you very much, Dr. Hind, and I wish you a great evening.
Thank you. Thank you, Fatma, again for the invitation. And I really enjoyed your questions. And I hope, and thank you for the audience. And I hope they benefit from the information we provided and the conversation we had together. Thank you.